7 medications that can damage your kidneys. We are living in an era where medications are a part of everyday life. While they can be beneficial, they also have the potential to cause silent harm. As we grow older, our kidneys' efficiency declines, making it crucial to limit their exposure to excessive chemicals and medicines. However, this is difficult because aging often comes with numerous health issues that require more medication. Some drugs are nephrotoxic, meaning they can harm the kidneys directly or indirectly, reducing their ability to filter blood and causing a buildup of harmful waste, which can lead to serious health problems. The severity of kidney damage is measured in stages, from mild impairment to complete failure. The risk of kidney damage from medications or drug-induced nephrotoxicity increases with age and existing kidney conditions. There are 2 main types of drug-related kidney damage: dose-dependent toxicity, where damage increases with higher doses, and idiosyncratic toxicity, which is unpredictable and varies greatly among individuals. Sometimes, it is best to avoid these drugs altogether. Drug-induced nephrotoxicity can stem from conditions like muscle tissue breakdown, rhabdomyolysis, kidney tissue death, renal infarction, and acid buildup, renal tubular acidosis. These conditions can lead to decreased kidney function and other issues such as nephrotic syndrome or electrolyte imbalances. In this video, we will discuss the effects of 7 medications on kidney health and offer practical tips for safely managing these drugs. By understanding the associated risks, you can make informed decisions about your health care. Stay with us to learn how to protect your kidneys while effectively treating other medical conditions. Before we begin, please note that all the information presented in this video is created by humans for humans. We do not use artificial intelligence writing tools like ChatGPT to generate content. Rest assured, our information is thoroughly fact-checked, unbiased, and reviewed by qualified professionals. All right, let's return to the topic of medications that can be harmful to your kidneys. 7 medications that can be harmful to your kidneys. 1. Antibiotics. Antibiotics are prescribed frequently, but they come with risks. Does your doctor prescribe antibiotics for your sore throat, skin infection, or other infection? If so, it could be harming your kidneys. First, let's understand what antibiotics are. Antibiotics, also known as antibacterials or antimicrobials, are a group of medications designed to combat bacterial infections. They work by either killing bacteria or preventing them from reproducing. Common antibiotics include brand names like Cipro, Augmentin, Flagyl, Bactrim, or amoxicillin. These drugs might be prescribed to treat strep throat, pneumonia, urinary tract infections, UTIs, or skin infections. Antibiotics can treat these bacterial infections, but they can't treat viral infections such as colds, flu, bronchitis, most coughs, and most sore throats. So you should be extra cautious when your doctor prescribes antibiotics. If prescribed improperly, you might experience side effects such as diarrhea and liver and kidney problems. Even when properly used, some antibiotics, such as polymyxins, aminoglycosides, and vancomycin, can harm your kidneys. Simply put, your kidneys play a crucial role in removing antibiotics and other drugs from your body. However, antibiotics like polymyxin may damage kidney cell membranes, possibly causing kidney injury. Similarly, another antibiotic, aminoglycosides, can accumulate in kidney cells, causing cell death and harming kidney tubules. The mechanism by which each antibiotic causes kidney injury is still not fully understood, but it might involve inflammation and harm to kidney cells. For antibiotics to be effective and safe for kidney health, it's important to use them correctly. Did you know that nearly 1/3 of antibiotics prescribed in the United States aren't even appropriate for the conditions being treated? That's according to a report from the Centers for Disease Control and Prevention, CDC, and a study published in the Journal of the American Medical Association. Before you ask for an antibiotic, or if your doctor prescribes one, knowing which conditions they can treat is important. You can ask them, "Is this necessary?" And most doctors will gladly explain why it's needed. If antibiotics are truly needed, follow the dosage exactly as instructed and adhere to any food requirements. Even if you feel better, Never save antibiotics for future use or give your prescribed antibiotics to someone else, as prescriptions are tailored to individual health needs and conditions. Are you enjoying our video so far? If so, please give us some hints by dropping a like, and we'll make more content like this. 2. Non-steroidal anti-inflammatory drugs, NSAIDs. Some may not recognize non-steroidal anti-inflammatory drugs, but have you heard of ibuprofen, aspirin, Motrin, Celebrex, Celecoxib, or naproxen? Yes, they're all NSAIDs, and you can purchase some of them without a prescription. In fact, NSAIDs are very common. Over 30 million people take them daily. NSAIDs are commonly used to ease headaches, sprains and strains, colds and flu, and pain from arthritis. At their core, NSAIDs mainly work by blocking an enzyme called cyclooxygenase, COX. This enzyme helps produce pain-causing substances. However, COX is also important for protecting the kidneys during stress and helping regulate sodium and water excretion. So when NSAIDs block COX, it's a big reason why these drugs can harm your kidneys. In fact, all NSAIDs can cause acute kidney injury, AKI, especially in older people and when taken in high doses or over extended periods. This injury appears in two main ways. One, because blood flow changes, and the other, because of inflammation, both caused by blocking COX. First, blocked COX can narrow kidney blood vessels, reducing blood flow. This can lead to fluid retention, high blood pressure, and even mild temporary kidney impairment. If this goes unchecked, it might cause more severe issues like acute tubular necrosis, where kidney tubules die due to lack of oxygen, and acute kidney failure. Even though this can initially look like acute kidney failure, it could eventually progress to chronic kidney disease. Second, although NSAIDs are anti-inflammatory drugs, prolonged use can trigger inflammation in kidney tubules, the tiny structures that filter waste. This inflammation is rare, but overall, kidney issues stemming from NSAIDs are a big concern, affecting 1% to 5% of daily users worldwide. This means that each year, around 500,000 to 2.5 million people experience kidney injury from NSAIDs. What's worse, these drugs are often involved in hospital admissions because of adverse drug events, some of which can be deadly. A 2006 study published in the Journal of the American Society of Nephrology analyzed data from over 10,184 people who were prescribed NSAIDs for various conditions. The results showed that NSAID use raised the risk of acute kidney injury by 26%, especially within the first 30 days of use. This result emphasizes the need for caution when prescribing and using these medications. In another study, scientists looked at 99 patients with chronic musculoskeletal pain who took NSAIDs for 12 months. They found that most patients' kidney function decreased after NSAID use, but returned to normal after switching to another pain reliever drug. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. Now, the next set of drugs on our list might surprise you because they're typically considered pretty good for your kidneys. 3. Diuretics. Diuretics help manage conditions like fluid retention or swelling, often seen in heart and kidney failure and liver cirrhosis. Some diuretics are available over the counter, but prescription diuretics are typically stronger. Common diuretics include hydrochlorothiazide, HCTZ, bumetanide, Bumex, furosemide, Lasix, spironolactone, aldactone, and acetazolamide, Diamox. They work by increasing urine output. They also help remove excess salt and water through urine, which can assist in managing hypertension, a leading risk factor for kidney disease. Thus, diuretics are generally considered suitable for kidney health. However, diuretics do not come without risks, especially concerning kidney health. They don't directly damage the kidneys or affect their filtering function like NSAIDs. Instead, they act further down the kidney's process, altering the urine's concentration and composition. This increases the amount of urine or changes the levels of electrolytes in it. So, excessive use or high doses of diuretics can lead to dehydration, which is a risk factor for kidney damage. A study examined 131 patients using diuretics and experiencing acute kidney injury from 1999 to 2010 at a hospital. Initially, 96.2% of the patients already had at least one health issue before starting diuretics, with chronic kidney disease, CKD, being the most common at 55%. They found that patients who used diuretics had higher rates of kidney disease and its risk factors like hypertension and diabetes. The higher the dose, the greater the risk. Additionally, about 27.5% of the cases of acute kidney injury were caused by diuretics alone, while others were due to a combination of diuretics and other drugs. So, always consult your doctor before starting new medications with diuretics. For people with CKD who are taking diuretics, it's important to stay hydrated and regularly check for electrolytes in the blood. 4. Proton pump inhibitors, PPIs. PPIs are used to treat acid-related diseases, such as stomach ulcers and acid reflux, by reducing stomach acid production. They are generally safe and effective for short-term use, but long-term use can lead to kidney problems, including chronic kidney disease and acute kidney injury. PPIs are very commonly prescribed and are available over the counter. If you have stomach ulcers, gastroesophageal reflux disease, GERD, and Zollinger-Ellison syndrome, you may be prescribed or have been prescribed a PPI in your lifetime. This group of drugs includes omeprazole, Prilosec, esomeprazole, Nexium, and lansoprazole, Prevacid. The kidneys are particularly susceptible to PPIs because they contain proton pumps. Prolonged use of PPIs can cause the immune system to attack the kidneys. This is called acute interstitial nephritis, AIN. AIN is a condition that causes inflammation and swelling between kidney tubules. Even though AIN is an uncommon cause of acute kidney injury, it's the most frequent adverse effect of PPIs on the kidneys. Prolonged PPI use is also associated with a higher risk of chronic kidney disease and end-stage renal disease, ESRD. A 2016 study published in JAMA Internal Medicine examined data from over 173,000 PPI users and 20,000 H2 blocker users, another type of acid-suppressing medication. They found that PPI users had a 20 to 50% higher risk of developing CKD than H2 blocker users. Similarly, another study of more than 125,000 people published in the same journal in 2017 found that PPI users had a 96% higher risk of developing ESRD than non-PPI users. While PPIs are effective for managing acid-related conditions, it's important to weigh the benefits against potential risks, especially for long-term use. This means discussing with your doctor to see if you can use alternatives like H2 blockers or if lifestyle changes can manage your symptoms. Please subscribe to our channel if you want to see more educational content like this. 5. ACE inhibitors and ARBs. ACE inhibitors and ARBs are commonly used to treat high blood pressure and heart failure, and they are often prescribed for people with kidney disease or diabetes. They are beneficial in reducing proteinuria and slowing the progression of chronic kidney disease. However, they can also cause acute kidney injury, especially in certain situations, such as dehydration or when taken with other medications that can affect kidney function. If you're taking medications for heart disease or high blood pressure, chances are you've come across ACE inhibitors and ARBs. ACE inhibitors include drugs such as lisinopril, enalapril, and ramipril, while ARBs include losartan, valsartan, and irbesartan. They help relax blood vessels and reduce blood pressure. This can be particularly beneficial for people with diabetes and heart disease. However, they can also cause kidney damage, especially when combined with certain conditions or other medications. ACE inhibitors and ARBs work by blocking the renin-angiotensin-aldosterone system, RAS, which helps regulate blood pressure and fluid balance. While this can be beneficial for heart and kidney health, it can also reduce blood flow to the kidneys and decrease the glomerular filtration rate, GFR. This can lead to acute kidney injury, especially in patients with pre-existing kidney disease, dehydration, or those taking other medications that affect kidney function. A 2013 study published in the Clinical Journal of the American Society of Nephrology examined data from over 2 million patients and found that ACE inhibitors and ARBs were associated with a 50% increased risk of acute kidney injury. Similarly, A 2016 study published in the British Medical Journal analyzed data from over 570,000 patients and found that those taking ACE inhibitors or ARBs had a 30% higher risk of acute kidney injury than those not taking these medications. Despite these risks, ACE inhibitors and ARBs can be beneficial for many patients, especially those with diabetes, heart disease, or chronic kidney disease. It's important to weigh the benefits and risks and regularly monitor kidney function while taking these medications. Discussing with your doctor the best treatment plan for your specific condition is essential. 6. Statins. Statins are widely used to lower cholesterol levels and reduce the risk of cardiovascular disease. While they are generally safe and effective, they can cause muscle damage and kidney injury in rare cases. Statins are among the most commonly prescribed medications worldwide. If you have high cholesterol levels or are at risk for heart disease, you might be prescribed statins. Common statins include atorvastatin, Lipitor, simvastatin, Zocor, and rosuvastatin, Crestor. Statins work by blocking an enzyme called HMG-CoA reductase, which plays a crucial role in cholesterol production in the liver. This helps lower LDL cholesterol levels, often called bad cholesterol, and reduces the risk of cardiovascular events like heart attacks and strokes. However, statins can also cause side effects, including muscle pain, weakness, and a rare but serious condition called rhabdomyolysis. Rhabdomyolysis is a severe muscle injury that can lead to the release of muscle protein called myoglobin into the bloodstream. Myoglobin can clog the kidney's filtering system, leading to acute kidney injury. This condition is rare, but it can be life-threatening if not treated promptly. A 2015 study published in the American Journal of Cardiology found that the risk of rhabdomyolysis was higher in patients taking high doses of statins or those with pre-existing kidney disease. While the overall risk of kidney injury from statins is low, it's important to be aware of the potential side effects and discuss any concerns with your doctor. Regular monitoring of kidney function and muscle enzymes can help detect and manage any adverse effects early. 7. Lithium. Lithium is a medication commonly used to treat bipolar disorder and other mental health conditions. While it can be very effective, it can also cause kidney damage, especially with long-term use. Lithium is used to manage mood swings and reduce the risk of suicide in people with bipolar disorder. It works by affecting the flow of sodium through nerve and muscle cells, which helps stabilize mood. However, lithium can also affect kidney function, especially with long-term use. Prolonged lithium use can lead to a condition called nephrogenic diabetes insipidus, NDI, which affects the kidney's ability to concentrate urine. This can lead to excessive urine production and increased thirst, potentially causing dehydration and kidney damage. A 2017 study published in Lancet Psychiatry examined data from over 1,600 patients with bipolar disorder and found that long-term lithium use was associated with a higher risk of chronic kidney disease. While lithium can be very effective for managing bipolar disorder, it's important to monitor kidney function regularly and discuss any concerns with your doctor. Adjusting the dosage or switching to alternative medications can help manage the risks while still providing the necessary treatment for your condition. While medications can be essential for managing various health conditions, it's crucial to be aware of their potential effects on kidney health. Regular monitoring, open communication with your healthcare provider, and staying informed can help protect your kidneys while effectively managing your health. If you have any concerns or experience any unusual symptoms, don't hesitate to contact your healthcare provider. Your kidneys are vital for your overall health, and taking proactive steps can make a significant difference in maintaining their function and well-being. We hope you found this video informative and helpful. If you did, please give it a thumbs up, share it with your friends and family, and subscribe to our channel for more health-related content. Stay healthy and take care.